In this week's Eye on Health feature, the focus is on a serious epidemic, opioid addiction. It seems most everyone has a friend, a loved one, a family member with an addiction problem, or maybe they have one themselves.
Some see addiction as a weakness or a moral issue, but our partners at Highmark and AHN are working to change that perception and really reduce the stigma of addiction in their continued war on opioids. And they just got a new weapon in their arsenal to fight that war. And here to tell us more is Dr. Ceasar DeLeo, Vice President and Executive Medical Director of Strategic Initiatives at Highmark. Thank you for being here.
Good morning, Heather and David. It's very nice to be here with the PTL audience.
Well, we're happy to have you. I mean, this is something that really, truly impacts, and not just in Western Pennsylvania, but across the world. We've just seen staggering numbers. So let's talk about really what opioid addiction is and how it gets started in a lot of people.
Opioid addiction, it starts with medications, opioids, that can control pain, but they also affect the pleasure centers of the brain. And those pleasure centers over time require more and more opioids to just maintain a sense of well-being. And when that happens, people escalate their dose, and then at some point they may not be able to get the quantity of pills that they need, and they may turn to injection drugs such as heroin.
And we mentioned at the start of this that there was good news because you guys have gotten a $5 million grant. How will that help in your program?
Well, that will help with the AHN system to do education and outreach, which is very important, and to support the development of programs that will deliver care to people.
Well, and you guys have really started this initiative a while ago with a three-pronged approach. So tell us what those three prongs are with this.
Yes, the three-pronged approach really consists of the first prong, which is decreasing the amount of opioids that are prescribed. This epidemic slowly started in the 1990s with physicians thinking that it was safe to prescribe opioids and increasing the amount of opioids. So to decrease the amount of opioids through education for physicians, feedback as to their prescribing patterns, and also putting some limits on the amount of opioids that are prescribed. So that actually in 2018 we were able to reduce the amount of opioid prescriptions given out in our membership by 15%.
Wow.
So that's incremental improvement. The second prong is to make sure that people who have pain are adequately treated and preferentially with non-narcotic therapy. And these are national guidelines put out by the Centers for Disease Control. And for those individuals who are on opioids, to reduce their dose. And also to use alternative therapies such as physical therapy, chiropractic, acupuncture, and whatnot.
So people who have chronic pain and have to manage that, if they're watching this and they're getting nervous about, oh, you can't take that away from me, that's not necessarily the case, but there are other alternatives as well, right?
Absolutely. And it's really a multidisciplinary approach to pain management. Your primary care physician may be the one who starts you with managing your pain, but over time, as your pain becomes, for some individuals, more complex, it may require a referral to a pain management specialist.
What's really unique with these drugs in particular is that people feel the pain. They feel, because you were talking about you need more and more of the opioids. So they truly do feel the pain and feel like they really need more to suppress that.
Absolutely. And it takes over the brain. It actually rewires the brain. And that gets to a very important point that you had started mentioning, is that in a recent survey that Highmark conducted with its membership, 9 out of 10 individuals responded that they felt that addiction was a moral failing. And this is nothing farther from the truth.
Right.
Because it is a rewiring of the brain. You, myself, we can all become addicted, and we won't become ourselves. So what we need to do is we need to reach out to individuals with addiction and get them into effective treatment.
I mean, these drugs can really take over how I mean, you can't control how your brain reacts to an opioid. It just does what it does.
You become like a zombie.
Right. So let's talk about some of the ways that people can seek help. Women, children, and some others who may need that help.
Women in particular are at risk when they are pregnant, and that is because their unborn baby can be exposed to injection substances, bacteria, viruses, lack of prenatal care, birth defects, learning disabilities, and after delivery something called neonatal abstinence syndrome, where they're born addicted. So we have some very special programs in Pittsburgh, in particular at West Penn Hospital, the Perinatal Hope Program, which is a multidisciplinary approach to treating women who specifically have addiction, and that starts before the delivery, during the delivery, and after the delivery. And I think we'll be sharing that number on the screen with you.
Yeah, we'll get that. And also something that's unique, trying to help children who are grieving because they've lost a parent in this. That's so sad, but there is help out there, right?
There is. This is a terrible epidemic. Many parents have passed away from this, and there are children who are grieving, and grandparents and extended family that are grieving. So Highmark has the Caring Place. It's downtown Pittsburgh on Stanwyck Street. We can share the number with you, and we invite you to come and visit the Caring Place someday, but it does tremendous work to help with the grieving process for families.
Dr. DeLeo, we could have this conversation for hours, but we thank you for joining us for a few minutes here on the couch.
Well, thank you very much.
Yeah, really important stuff. And keep watching for our Eye on Health series here on PTL. It's every other Wednesday, sponsored by Highmark Blue Cross Blue Shield, together with Allegheny Health Network.